Now we've got case 5. 70-year-old man with erythematous plaques on the face and the groin.
Okay, so this looks like a punch biopsy. The pathology looks more in the epidermis, so we really saw some pallor and ballooning of the upper epidermis. So it made us think of acrodermatitis enteropathica.
Yeah, you guys are too good. Yeah, right away, there's the ballooning and pallor, the pale, white, washed out appearance of those keratinocytes in the superficial spinous layer. That's the classic finding, right, in acrodermatitis enteropathica, which of course is a deficiency of zinc. And it can be seen, this same pattern can be seen not only in zinc deficiency, but in other forms of nutritional deficiency, vitamin or mineral deficiencies can have this. And you could also see it, as I'm sure you guys well know, in people that have, what other entities can you see this pattern in, aside from nutritional deficiency?
Glucagonoma.
Yeah, glucagonoma syndrome, which is known as necrolytic migratory erythema in patients who have a glucagonoma type of neuroendocrine tumor of the pancreas. And my understanding is usually when they develop that syndrome is when they have had metastases to their liver, and then they get circulating endocrine products that somehow result in this. And I don't know the exact mechanism. I'm sure someone has described it, but I don't know what it is. And then the other thing is there's something that can occur on the acral skin, which is necrolytic acral erythema. I always get the wording, the order of words confused, and it can have a similar appearance. I don't think I've ever seen a real life case of that, but it can have this pallor and psoriasiform epidermal hyperplasia, and it's supposedly more commonly associated with hepatitis C. So this is about as good a pallor as you could ask for, right? I mean, it's really dramatic. Now, I will point out, though, that not every case of nutritional deficiency or glucagonoma syndrome are going to have this good a pallor, okay? So sometimes a kind of unusual psoriasiform dermatitis and the clinical that makes me think of, periorificial psoriasiform plaques, around the genitals, around the anus, around the mouth, around the face. And then I see an unusual psoriasiform kind of pattern microscopically. Even without the pallor, I'll still think about nutritional deficiency and maybe think about glucagonoma. And I've seen one case of confirmed metastatic glucagonoma that the patient had psoriasiform change. It wasn't quite like psoriasis, but it was psoriasiform. It had no pallor, and it was the presenting sign that they had metastatic glucagonoma. So I try to keep an open mind, but this is, to me, like the textbook of what it's supposed to look like. And in this case, this was actually confirmed zinc deficiency, confirmed by blood testing or serum testing. All right, great work. You guys are just polishing these off. We'll have to like pull some other slides to show you. Usually 8 slides I'm like trying to get done in an hour. I guess it's because if I just need to put in more complicated soft tissue tumors, and I tend to talk a long time about those. That's the problem. The problem's me here. Okay.